Hello and welcome back. Today I'm going to talk to you about cardiovascular disease and nutrition. So, what is cardiovascular disease and who does it affect? Cardiovascular disease is primarily heart attacks, strokes, and high blood pressure or hypertension. In the United States, cardiovascular disease claims the lives of more than 800,000 people every year. It's a very serious disease. You need to know some key terminology for understanding cardiovascular disease. First is atherosclerosis. This is the accumulation of fatty deposits in the arteries. An aneurysm is another key term. It's a dilation of an artery. Ischemia is insufficient blood supply. Infarct is an area of coagulation that leads to a deficient blood supply. It's usually associated with heart attacks. Myocardial infarct, as I said, is a heart attack. Cerebral infarct are strokes. Infarcts in your extremities lead to gangrene. Stenosis is narrowing of the blood vessels by these fatty deposits. Embolus is a plug or a clot that has detached and is occluding a blood vessel. This often leads to stroke or heart attack. Thrombus is again a blood clot which can occlude an artery and lead to a heart attack or stroke. And hypertension is high blood pressure. You can see from this graph here on the left that cardiovascular mortality, cardiovascular disease mortality has dramatically increased since the early 1900s, peaking here in the 1970s. You can see also that parallels rates of smoking in the United States. And in fact, smoking is the #1 cause of cardiovascular disease in the United States, the #1 modifiable cause of cardiovascular disease. Nutrition is another cause. In terms of cardiovascular disease, coronary heart disease is the most common, stroke is next most common, and there's heart failure, high blood pressure, and a variety of other diseases that cause death. Risk factors. There are modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors are age. Cardiovascular disease gets worse with age, sex, ethnicity, and family history. In terms of modifiable risk factors, there's obesity, smoking, as I said, physical inactivity, high blood cholesterol, hypertension, diabetes, diets high in saturated fats, and psychological stress. You can see these three, obesity, high blood cholesterol, and diets high in saturated fats, are all nutrition related. An atherosclerotic narrowed blood vessel is shown here. You can see that these fatty deposits narrow the blood vessel. If this blood vessel gets occluded, you can end up with lack of blood supply to the heart and a heart attack. Same can also occur with a ischemic stroke. Fatty deposits on the side of the blood vessels can cause occlusion, and blood supply can be cut off to the brain, causing stroke. There's also a thing called a hemorrhagic stroke, where a blood vessel bursts and causes pressure on the brain and damage. Yeah, let's take a look at atherosclerosis, the problem with heart attacks and strokes, and also high blood pressure or hypertension. There is damage that can occur in your blood vessels for a variety of reasons. Smoking is one of those reasons. Other reasons include diabetes and high blood glucose. There are a variety of different reasons where damage can occur, and inflammation occurs at these sites of damage. Along with inflammation are infiltrates of white blood cells. These white blood cells can accumulate fats, become foamy cells, and this deposit can grow and cause a blockage in an artery, leading to your heart, leading to your brain, or even in your extremities. So it requires these two stages. First, damage and an inflammatory response, and then fatty deposits. Yeah, here are some causes of endothelial damage: high cholesterol, elevated lipids, high blood pressure, smoking, high blood glucose, obesity, various toxins that you can ingest, and viruses can cause this. You need to know a little bit about lipids. There are lipids that you need to be cautious of to make sure that they're maintained in the right amounts in your blood. Those are chylomicrons or remnant chylomicrons, very low density lipoproteins, intermediate density lipoproteins, and low density lipoproteins. The idea is not to have too many of these lipids in your blood. On the other hand, high density lipoproteins, they are a form of reverse transport that removes cholesterol from your periphery and takes it back to your liver for processing into bile and bile acids. It's good to have more high density lipoproteins, and you can get those by exercising more. Your lipids. Cholesterol needs to be less than 200 milligrams per deciliter. Low density lipoproteins less than 130 milligrams per deciliter. High density lipoproteins greater than 40 milligrams per deciliter. This is the one that you want to have more of. And triglycerides or fats in general should be less than 150 milligrams per deciliter. Your doctor can test your blood to see what your lipid profile is like. They'll do that with a lipid profile test after taking a blood draw. Adults who are older than 20 should have fasting lipoprotein profiles done once every 5 years. So make sure that you're getting this done regularly. Diet is the predominant environmental cause of coronary atherosclerosis. The goals, your primary goals are to keep your low density lipoproteins, your fats in your blood low. And it's important to have a healthy diet with good physical activity. Let's talk about the treatments for cardiovascular disease. Here they are. Medical nutrition therapy in conjunction with physical activity is highly recommended. It's important to keep your blood glucose in a safe range and use blood glucose monitoring. Medications such as statins are very effective treatments for cardiovascular disease, and it's important, as with all these things, to educate people to manage all of these treatment modalities at one time. I'm going to talk a little bit now about medical nutrition therapy. Medical nutrition therapy, the goals are stated here. Saturated fat needs to be less than 7% of your total calories. Polyunsaturated fats and monounsaturated fats are more healthy in cardiovascular patients and should be swapped in for saturated fats. Total fat should not exceed this 25 to 35% of total calories. Carbohydrates should be in the 50 to 60% of total calories. Fiber, 25 to 30 grams per day. Protein should be reduced to around 15% of total calories. And cholesterol should be less than 2,000 milligrams per day. You'll notice that this medical nutrition therapy looks very similar, in fact, to this medical nutrition therapy you would see for diabetes. Yeah, looking a little further, there are some ways that you can reduce your cholesterol by changing the foods that you eat. One way is to increase the amounts of soluble fiber in your diet to at least 5 to 10 grams per day. Soy protein is effective for reducing cholesterol. Plant sterols, so a diet rich in plants, foods, vegetables, and fruits is helpful. Reducing dietary cholesterol by reducing the amount of meat in your diet is helpful, as is reducing saturated fat. Generally, the goal is to lose approximately 10 pounds for most people. Other important guidelines are illustrated here. It's really important to completely stop smoking, to decrease blood pressure, either medically or through a DASH diet. I'll talk about a DASH diet later in this video series. Moderate physical activity is important for cardiovascular disease, as is maintaining a body mass index of less than 25. You need to maintain your blood glucose and be very careful with this. Some people propose the use of low dose aspirin and antihypertensive drugs such as statins are particularly effective at reducing cholesterol. Thanks so much. I hope you found this introduction useful. Look forward to speaking to you again soon. This is the references and disclaimer page. The reference textbook that most of these videos follow is Understanding Nutrition by the authors Rolfs and Whitney. I use the 15th edition by Cengage Publishing. Please subscribe to my YouTube channel. It's called Nutrition, Fast and Fun. There's lots of great videos that you'll find there. And finally, there's a medical disclaimer. You should read the medical disclaimer to make sure you fully understand your rights and responsibilities. Thank you and have a great day.